Welcome to Workplace Wellness. My name is Dani Ondreka, Community Outreach Fitness Specialist with Kettering Health Network. And this presentation is designed to give you tools to stay healthy and stay moving even in the workplace. So first, let's discuss the dangers of sedentarism. Now, being sedentary is characterized by a lack of exercise or excess sitting, which many of us do experience if we have a job where we sit during the day. Now, there are very, very harmful effects on the body and the mind due to lack of exercise, several of them being cardiovascular disease, muscle and joint pain, high blood pressure, cancer, and depression, among many others. If we look at the benefits of exercise, there are obviously many: improved sleep and quality of sleep, increased ability to perform everyday activities, improved cognitive awareness and abilities throughout the day, reduced risk of dementia further along the line in the rest of your life, and then improved bone and musculoskeletal health, which also leads us to having less injuries and less pain. So let's talk about actual exercise and movement on the job, some specific stretches and specific exercises that we can do while at work. First, let's discuss some seated exercises. Now, these are helpful in maintaining good posture during the day, which will help decrease neck pain, lower back pain, and general joint pain in the knees and in the hips. So we're going to start with what's called a scapular retraction. Now, your scapula are also known as your shoulder blades. When we pinch them together, it's known as a retractive movement. When they come forward and we hunch, it's known as protraction. So to begin, we sit up nice and tall. We pull our shoulder blades together in the back and down our spine. And we hold maybe for 2 to 3 seconds, continuing to breathe, and then relax just back to neutral. Not hunching forward, just a nice neutral spine. So we open the chest, we squeeze the shoulder blades back and down, we continue to breathe, and we relax. Now, we could do this in a couple of different ways. We could bring the arms wide if we wanted to hit a little bit of a different angle and imagine pulling back. We could also do this low with the elbows close to our body. Again, pulling back, shoulder blades coming down and in. Now next, let's talk about thoracic extensions. Also great to do if we are experiencing any lower back pain or back tension down the sides of the spine throughout the day. You're going to scoot all the way back into that desk chair, bringing the hands behind the head if it's comfortable. Simply leaning back into that chair, we're going to open the chest with a big breath in, allowing those elbows to drop back. As we exhale, we release forward. So big breath in, we drop back, open the chest. Breath out to relax, and you can repeat that as many as 8 to 10 times, whatever feels comfortable, not wanting to extend so far that we feel any pain, but obviously still wanting to feel a stretch with that movement. The last one here we have in our postural section is called a chin tuck. Really great at decreasing any pain in the bottom of the skull or those suboccipital muscles, as well as the front of the neck. So what we want to do here is maybe take a hand or 2 fingers just on the chin. We're going to gently press straight back and tuck. So you may notice you kind of develop a little bit of a double chin there, which is okay. It's not permanent. We're just going to pull straight back, being sure not to take the head down, but maintaining that good posture, forward and back. Again, maybe holding for a second or 2 here, and then bringing it back forward. So as we strengthen those front muscles of the neck, your head becomes less likely to drop forward during the day, which is where we find that neck pain. Next, let's talk about ergonomics. So your body positioning and how you sit during the day has incredible ramifications for your posture and for joint pain or lack thereof. So when we discuss the theory of the 90-90, we're talking about angles of our knee and of our hips. So when we sit, we always want our chair to be at a level where our hips can be bent at 90 degrees. Same thing with the knees. We have a nice 90-degree angle where those feet can touch the floor nice and flat, and they're not any higher than that 90-degree angle. They're not any lower. Thighs remain parallel with the floor. Now, as we're thinking about the head and the neck and our upper body, we also want to think about the surfaces that we are looking at during the day. So the more we can bring those surfaces to eye level, i.e. our computer, maybe something we might be reading if you have a reading stand to place your notes on or a notebook, once we bring those things to eye level, there is much less ability for your head to drop forward here and for gravity to take over. Because once this angle starts, we just continue forward. So the more we can keep our eye level parallel with the ground, the more that body remains upright, we have less chance to have pain in our back and in our neck. Let's discuss a few more seated exercises here, specifically back mobility. So often when we're working, especially when we're seated during the day, we might experience tension in our back. So a few exercises to counteract that. We're going to start with a cat-cow, which some of you might know as a yoga pose, generally done on the floor in all fours, but it can also be done seated or in standing. So as we sit, there are two motions they're going to go through. As we come forward, we push our stomach and our chest out in a way the back arches just slightly. That's known as cow. You think about your stomach growing, moving away from you. We can also curl back in the opposite direction, allowing the shoulders to hunch forward, pushing the center of our spine back behind us. That would be cat, in the same way a cat arches its back up. So we take a big breath in, we create space for the air in the stomach and in the abdomen. As we breathe out, we curl here. We push the center of that spine back behind. We want to keep those feet nice and flat on the floor, and as we open forward, we pull those shoulder blades back and down. As we press back, we allow that spine to stretch. And you can go as far forward or as far back as you'd like to, wanting to stay away from any painful spots, so not stressing the spine maybe maximally in one direction or the other. And repeating at least 10 to 15 times to fully get that stretch. Next, we have a seated thread the needle, which could also be done on the floor. Here, we're going to place both of our hands on the desk. We're going to slide one hand up underneath. So this is the motion of threading that needle, as if this arm was that needle. We're going to reach all the way through, perhaps laying down into that shoulder, and we feel a stretch there in the upper to mid spine. So same thing, other side, we reach up underneath. And we can hold this for even up to 30 seconds, 20 to 30 seconds, if that feels good to us. If it doesn't, you can always stay moving. We do want to make sure as we reach that the shoulder blade on that reaching side is moving away from the spine, and that's how we're going to feel that stretch a little bit more fully. Perfect. All right, let's talk about a wide leg toe touch. So here, sitting towards the edge of a chair, we're just going to take our feet out as wide as we feel comfortable in an effort to open up those hips just a little bit. We're going to lean forward, reaching with our chest, not just our nose. So we push that chest out forward, shoulders are down and back, and we have the ability here to go through as much range as we'd like to. We can reach all the way down towards that floor if we are able and really start to feel some pressure opening up in those hips. We also have the ability to push out with our elbows just slightly with those knees. But the further we come down to the ground, as long as that spine is straight, we're going to feel a deeper stretch, just making sure that we don't curl or hunch there in that position. Our last exercise here within our back mobility section is going to be a seated side stretch. And there are several ways that you can do this. We're going to take one arm, we're going to reach up above the head towards our opposite side. We do want to anchor our opposite hip. So I'm not allowing my body to lift and to fall all the way out of the chair. That's very unsafe. We can reach all the way over here with one hand. We can also rest the hand on the side of the head if that's not quite comfortable to reach all the way up and over. Anchor those hips and simply lean to where you start to feel a stretch in your side. We want to maintain the side being pointed up towards the ceiling. The chest stays open, so we're not collapsing forward. And when we're here, we can get a little bit of an extra stretch by taking a nice big breath in. So feel that rib cage as you breathe in, expand, and feel it collapse as you breathe out. And that extra breath really just kind of helps you to increase that stretch and feel it a little bit deeper, especially in those spaces between your ribs that are hard to stretch. So we always want to make sure we do both sides, reaching up and over, anchoring both hips. Big breath in, breath out to release. I keep my chest open. Just like that. This next section that we're going to discuss, we're going to look at tight hips. So often when we sit and we're immobile, especially for several hours, especially at a desk, we do tend to get tight hips. So first, let's look at a seated hip extension. In a seated position, we're going to scoot to the very edge of a chair and over to the side just a little bit. This is possible both in a chair with arms and in a chair without arms, but it might be just a little bit easier in one without. So whatever you've got available to you. We're going to place our hands on the desk in front of us just so we don't fall out of that chair. And we're going to slide one leg back, almost like we're trying to kneel. Now here, we're going to plant that toe firmly. We're going to push forward through that hip. If it's not quite enough, we can even lean forward into that desk a little bit and apply just a little bit more pressure. You're welcome to extend that leg as far back behind as you are able to. We do want to make sure we do both sides. So again, we would scoot over towards that opposite side of the chair, coming to the very, very edge of it, taking that leg back behind, just pushing forward through that hip, imagining it driving towards that desk and using that surface as a little bit of stability there. Now, if you're really having a lot of trouble getting that hip behind you, you can also look at this another way. We can turn to the side a little bit and just simply open our legs here. We're going to send our chest forward towards one leg, and we're pushing through that hip and that inner thigh. So it's going to give us a little bit more of an inner thigh stretch, but absolutely still stretching through the front of that hip if you're unable to just twist quite that far. Same thing on the other side. We're almost at a 90-degree angle here with the legs. We send that chest forward towards one leg and keep that opposite knee pushed out. Just like that. Beautiful. Second one we're going to do here is a seated figure 4, which also has its roots in yoga pose. So here, we're just going to cross these legs over. And for everyone, this might not be possible. Maybe you've had a hip replacement, a knee injury, and this position is not comfortable for you. That's fully okay. We're going to take this bottom leg, and we're just going to slide out until we find a spot where we do feel comfortable. And if that's still not quite enough, we can also cross below the knee here, simply resting on the shin. So find a spot that feels comfortable to you, where we start to feel a stretch here on the outside of our hip, maybe back in the glute or the hamstring just a little bit. We can apply some pressure here with the hand towards the inside of that knee, just pressing gently down towards the floor. We don't want to press a lot of pressure directly into the side of the knee. Maybe we come just above or below very gently. And if that still is not enough, we have some other options here as well. We can again lean forward here with the chest, always reaching with the chest to keep the spine nice and straight. You can reach as far as you'd like to, keeping that spine straight to feel a deeper stretch back in the back here. We always want to make sure we do both sides. The more parallel this leg is with the ground, the deeper your stretch you will feel. So adjust as you need to. And if we're here in this position and we decide, all right, maybe I need a little bit more of a stretch, let's send that chest towards that foot that's been crossed over. Now that's going to increase our stretch in the back of the hamstring significantly. And we do want to fight to keep that spine nice and straight in this position as well. Always breathing, big breath in. Breath out allows those muscles to relax. And after you've held for 15 to 20 seconds there, go ahead and relax. This last one we're going to look at is less of a stretch and more of a regular exercise. So glute squeezes are exactly what they sound like. They're just squeezing your glutes. So when we sit in a seated position for a long period of time, our pelvis tends to rotate forward, which is not something that's always very comfortable, especially for our hips. They become very tight there in the front. So we can combat that, pull that pelvis back into correct alignment by squeezing our glutes and turning on those muscles. So just sit tall, just like it sounds. You're just going to squeeze those glute muscles. You're going to hold for about 3, 2, 1. And then go ahead and relax. You can repeat that anywhere from 8 to 12 times. 3, 2, 1, hold, and go ahead and relax. And one of the best things about this exercise is no one knows that you're doing it. So how do we incorporate exercises like these into our daily practice? One of the easiest ways to do this is to connect our movement with activities we do every day, or activities of daily living. So maybe connecting calf raises while we brush our teeth. Maybe we do some squats in between doing the dishes. We take a walk with our dog and we add a few exercises there as we're walking. We want to keep our goals small and realistic. So trying to change so many variables at once becomes very, very overwhelming and hard to repeat on a daily basis. So find a few things that you want to change in your day-to-day routine, make those a routine, and then add on. We also want to create a plan. So if we write something down, put it in a calendar, write out a few steps to make that vision a reality, then we're much more likely to actually follow through on that plan or that change. We also want to forget the all or nothing attitude. So the perfectionist attitude that if we don't achieve something, then we're just not going to achieve any piece of it. So again, starting with a small goal and then building upon it will go a long way into helping you achieve those goals of moving on a daily basis. So we hope this presentation provided you with some tools to stay moving, whether at home or in the workplace. And we wish you well, staying healthy and continuing to move. Thanks so much.